I laid in the bed for the first 3 weeks on phenylketonuria. I couldn't pronounce it. My child had it and I couldn't pronounce it.
Phenylketonuria is difficult to pronounce. That's why it's usually just called PKU. It's an inherited condition where the body is unable to adequately break down an amino acid called phenylalanine. A buildup of phenylalanine in the blood is toxic not only for the person with PKU, but if that person happens to be pregnant, more toxic to her baby, even if that baby doesn't have PKU. This is known as maternal PKU syndrome.
It's literally as toxic as fetal alcohol syndrome.
Babies exposed to high phenylalanine levels in the womb are at high risk of severe brain damage and other birth defects. That's why it's advised that women with PKU get their blood tested regularly, both before and during pregnancy. Since 1995, Emory University School of Medicine human genetics researcher Ronnie Singh has been running a week-long summer metabolic camp for girls 12 and older who have PKU or another similar genetic disorder called maple syrup urine disease, or MSUD.
The goal of this camp is to really educate them about it, why they should go on the diet before they get pregnant, and how to maintain the levels during pregnancy, and what kind of resources they have available to them.
It's really important to me. It's part of my life. It's where I see all my friends, and we reconnect, and we also make new friends and make new memories.
People with PKU must stick to a lifelong diet which curtails foods that boost their blood phenylalanine levels, often referred to simply as Phe levels.
In order to have children, you're going to have to go on diet, you're going to have to keep your levels, your Phe levels low.
23-year-old Mary Caitlin Allen first came to camp as a young teenager. She now works as a counselor here and is studying to be a registered dietitian.
This camp has made me very independent and has brought me to be who I am today.
Even though new medicines and specialized formula have made the burden of adherence somewhat easier, mutual support and information sharing are why many of the girls return to the camp year after year.
We collaborate with the Clinical Research Center here, which is funded through National Institute of Health, and we collect data on this rare disease to add new knowledge, and we have different protocols going simultaneously in addition to providing support and knowledge to the young women.
In addition to staying on top of the latest information, 20-year-old Brooke Martin enjoys seeing old friends and meeting new ones.
The first year, I wasn't used to being away from home, so it was a little rough, but I made a bunch of friends here, and it's really cool being around a bunch of people that have the same disorder as me.
I am 17 years old, of course with PKU.
This is Andrea Carmichael's first summer at the camp. She came all the way from Southern California.
I think it's really good for me because I'm really shy around people, and I think by being around other people it helps me to be more social and to be more open with my feelings and open about PKU in general.
Emory's Metabolic Camp is the only research camp of its kind in the world, and for 2 decades has helped girls with PKU learn workable strategies for sticking to their diet plan, especially if they're planning on having a baby.
If they are on a strict diet during that time and keep their blood Phe levels in control, they can have a pretty normal baby.